Children as young as 6 months old can now get the bivalent COVID-19 booster shot. The CDC expanded the eligibility of the vaccine earlier this month. Dr. Monica Singer is a pediatrician at Kapiolani Medical Center for Women and Children. She's also part of the Department of Health's COVID-19 vaccination program. Doctor, good morning. Why should Keiki, 6 months to 5 years old, get this new booster?
This vaccine is very safe and very effective at preventing really serious complications like hospitalization or death in children, and we've seen that in older adults as well. You know, we had very effective mitigation measures in place at the beginning of this pandemic, and as those are lifted and our school-age children return to school without masks and we're gathering with friends and family again and traveling, we're seeing not only the spread of COVID, but RSV and flu and other circulating respiratory viruses.
Now, if my child falls in this age group and received the Pfizer vaccine already, what's the guidance here?
So if your child started with Pfizer, which is for the 6 month to 4-year-old age group, is a 3-dose primary series. So dose 1 and 2 are the monovalent, the original formulation of the vaccine. And that 3rd dose for your child would be the bivalent updated vaccine. And for Moderna, it's a 2-dose primary series with the monovalent vaccine. And 2 months after completing that primary series, your child would be eligible for the bivalent Moderna vaccine.
What about side effects for this age group? What would those entail?
It's no different than what we expect with other routine childhood immunizations. If your child has had one of the COVID vaccines before, the side effect profile is very similar for the bivalent vaccine. Often maybe some low-grade fever, some pain and soreness at the injection site. For this younger age group, I always just recommend taking it easy in that evening after getting the immunization, maybe a warm bath or some warm compresses to the area where they get the vaccine.
And any differences between this bivalent booster and any previous boosters and vaccines that they've received already?
The new updated formulation has both half of the original strain and half of the spike protein antigen against Omicron variants BA4 and 5, which will help our immune systems recognize these newer variants that are now circulating, be able to fight those off more effectively.
All right, good information. Again, we're talking to Dr. Monica Singer from Kapiolani Medical Center for Women and Children. Thank you, doctor.
Thank you.
And thank you for helping to make this a healthier Hawaii.
Be safe. Happy New Year.